Venetian ceruse. Venetian ceruse, also known historically as spirits of Saturn, was a skin-lightening cosmetic used primarily in Europe from the Renaissance through the 18th century. The product was composed largely of lead carbonate, created by exposing metallic lead to vinegar fumes and carbon dioxide in a controlled environment. This process produced a fine white powder that could be mixed into creams or applied as face paint. Ceruse was valued for its ability to mask blemishes, scars, and discoloration, while providing a smooth porcelain-like finish that was fashionable among the elite. However, lead carbonate is a potent systemic poison. It can be absorbed through the skin over time, entering the bloodstream and accumulating in tissues. Chronic exposure results in lead poisoning, characterized by neurological symptoms such as tremors, irritability, cognitive decline, and seizures. Physical effects include hair loss, gum deterioration, tooth loss, and lead palsy, a form of muscle weakness. Hydroxycut, pre-2009 formulations. Hydroxycut is a dietary supplement brand marketed for weight loss, metabolism boosting, and energy enhancement. Prior to 2004, many hydroxycut products contained ephedra, an herbal source of ephedrine alkaloids. Ephedra acts as a stimulant, increasing heart rate, constricting blood vessels, and elevating blood pressure. While it could promote short-term weight loss through appetite suppression and increased metabolism, it also significantly raised the risk of heart attack, stroke, and arrhythmia. In 2004, after receiving more than 16,000 adverse event reports and documenting over 150 deaths linked to ephedra-containing supplements, the FDA banned ephedra from dietary supplements. Hydroxycut reformulated without ephedra, but safety issues persisted. By 2009, the FDA issued a recall on most hydroxycut products after reports of serious liver injury, including hepatitis, jaundice, and liver failure requiring transplantation. One death was directly attributed to liver toxicity linked to hydroxycut use. Slim 10 Diet Pills. Slim 10 was a widely marketed diet pill brand in Singapore, Hong Kong, and parts of Southeast Asia in the early 2000s. Marketed for rapid slimming, Slim 10 capsules contained herbal extracts and synthetic compounds. Laboratory analysis revealed the presence of fenfluramine, an appetite suppressant that works by altering serotonin levels in the brain to reduce hunger. Fenfluramine had been banned in many countries after its association with heart valve disease and pulmonary hypertension. Further testing found that Slim 10 also contained thyroid hormones, such as thyroxine. These artificially elevate metabolism, which can lead to dangerous weight loss, but also cause irregular heartbeat, muscle wasting, and severe strain on the cardiovascular system. The combination of banned pharmaceutical agents led to numerous adverse events. Singaporean authorities confirmed at least 9 cases of acute hepatitis and several deaths linked to Slim 10 use, including that of a young actress. In 2002, Singapore's Health Sciences Authority issued an immediate recall, banned sales, and prosecuted distributors. The case resulted in stricter supplement oversight and mandatory safety testing in the region. Neutrogena Light Therapy Mask. The Neutrogena Light Therapy Acne Mask was introduced as an over-the-counter device designed to deliver red and blue LED light to the face. Blue light at approximately 415 nanometers targets Propionibacterium acnes bacteria, which contribute to acne formation. Red light at around 630 nanometers is used to reduce inflammation and promote skin healing. The mask enclosed the face with an array of LEDs and was marketed for daily home use. However, in July 2019, Johnson & Johnson voluntarily recalled the product worldwide. The reason was a theoretical risk of eye injury, particularly for individuals with certain eye conditions such as retinal disorders, or those taking medications like tetracyclines or diuretics that increase photosensitivity. The concern was that prolonged exposure to high-intensity LED light close to the eyes could damage the retina. Although there was no widespread documented harm, the potential for irreversible eye damage led the manufacturer to withdraw the product from shelves and advise consumers to stop use. The recall applied to both the full-face mask and the activator units. Neutrogena and Clean and Clear Dark Spot Reducers. Johnson & Johnson's Neutrogena, Fine Fairness and Clean and Clear Fairness product lines were marketed in Asia and the Middle East as solutions for dark spots and uneven skin tone. Some formulas used active skin lightening agents, including hydroquinone in certain markets and other tyrosinase inhibitors in others. Hydroquinone works by inhibiting melanin synthesis, but prolonged use can cause ochronosis, a blue-black pigmentation disorder, and possible carcinogenic effects in animal studies. In 2020, Johnson & Johnson discontinued these lines amid heightened scrutiny of fairness-oriented cosmetics. The move followed a global conversation about racial equality and beauty standards, as well as increasing regulatory limitations on hydroquinone and other depigmenting agents. The company cited a desire to align with more inclusive messaging alongside compliance with evolving safety regulations. In several countries, such products are now prohibited unless prescribed and compounded under medical supervision. Nasal Melanotin 2 Tanning Sprays. Melanotin 2 is a synthetic analog of alpha-melanocyte-stimulating hormone. It binds to melanocortin receptors in skin cells, triggering increased production of eumelanin, which darkens the skin. Unlike topical tanning products, Melanotin 2 is typically administered by injection or, in illicit markets, via nasal spray. The nasal spray form became popular through social media marketing, with claims of fast tanning results without sun exposure. However, Melanotin 2 is not approved for cosmetic or medical use by any major regulatory agency. Risks include nausea, flushing, increased blood pressure, appetite loss, spontaneous penile erections in men, and accelerated growth of existing moles. There are also concerns about its potential to promote melanoma development. Because nasal spray formulations are unregulated, they may contain variable doses and contaminants. Health authorities in multiple countries, including the UK's MHRA, have seized shipments and issued public warnings. The sprays are illegal to sell or possess for personal use in many jurisdictions. Solcal & Company Body Mists with Lilial. Solcal & Company produced affordable body mists in multiple fragrance blends, such as raspberry and lotus blossom, mango and passion fruit, apple and water lily, cocoa plum and jacaranda, and beach rose and coconut water. In 2022, batches of these mists were recalled after testing confirmed the presence of butylphenyl methylpropional, known as Lilial. Lilial was once widely used as a floral fragrance component in perfumes, lotions, and body sprays. The European Union's Scientific Committee on Consumer Safety reclassified Lilial as a Category 1B reproductive toxicant, meaning it is suspected of impairing fertility or harming unborn children. Under EU cosmetic law, such substances are banned from cosmetic formulations. Retailers removed affected products from sale and advised customers to stop using them immediately. The incident highlights how fragrance safety assessments evolve over time, leading to reformulation of long-standing products. AETT in fragrances. Acetyl-ethyl tetramethyltetralin, abbreviated AETT, was a synthetic musk-like fragrance compound developed in the mid-20th century. It offered excellent scent longevity and fixative properties, making it popular in perfumes, creams, and soaps. Toxicological evaluations in the 1970s revealed that AETT was lipophilic, meaning it accumulated in body fat. Animal studies indicated potential neurotoxicity and organ damage with repeated exposure. The fragrance industry, through the International Fragrance Association, IFRA, voluntarily discontinued AETT in 1978. This decision predated some modern binding regulations, but set a precedent for industry-led ingredient phase-outs. Biologique Recherche Lotion P50 1970. Lotion P50 is a chemical exfoliant with a cult following, produced by French skincare brand Biologique Recherche. The original 1970 version contained phenol, an aromatic organic compound with strong antiseptic and keratolytic properties. Phenol can penetrate the skin, where it can cause protein coagulation and cell death, making it effective for deep chemical exfoliation. However, phenol is also highly toxic. It can cause chemical burns, systemic toxicity, cardiac arrhythmias, respiratory distress, and kidney damage. In the U.S., phenol is banned for use in cosmetics except under tightly controlled professional chemical peel procedures. As regulations tightened, Biologique Recherche reformulated Lotion P50 for the U.S. market, removing phenol and replacing it with other acids. The phenol-containing version remains illegal for over-the-counter sale in the U.S., though some international spas may still use it under medical supervision.